in June this year, there was the big research conference, the second big research conference in Rome that was arranged by the HRI. And there I saw a presentation of Philippa Fibert. She was presenting her work, her research on ADHD and homeopathy. And I was very impressed. And then Peter Wiksten also said that if you're making a conference on ADHD or anything that have anything to do with that, you must bring Philippa. And we're very happy that she accepted our invitation and are here with us today in Stockholm. Welcome.
Thank you. Thank you. Thank you very much indeed. And thank you for inviting me here. It does feel a little bit like a holiday. I've never been to Sweden before, and it's utterly beautiful. So thank you. Just one correction on your sheets. It looks on your sheet as though I have a PhD. I don't. I wish, but I haven't got one yet. I'm working very hard towards it, but it's a long way away. So I wouldn't want you to be under any misconception. So the PhD is being conducted at the University of Sheffield, which is where I'm also conducting a clinical trial. And today I'm going to take you through 4 different pieces of research that I've been involved in. And in order for you and me not to get confused, I've given them different pictures to go with them, so you'll know which bit I'm talking about. So I'm going to start off by just doing a general overview of the research that already exists into the treatment of behavioral disorders, ADHD and ASD, using homeopathy. And I'm going to focus only on those studies which are published and those studies which have comparators. And there's several reasons for that. The main one being that in the world of medical clinical research, those are the only studies that people look at. And I sometimes feel like I'm not a scientist, I'm not a researcher, I'm a translator, because it seems to me that we as homeopaths, we are very happy in our homeopathic paradigm. And there's another paradigm out there in another language, and the 2 languages do not communicate with each other. And part of the role that I see for myself is to try to facilitate communication about homeopathy to the world outside homeopathy, and that happens in peer-reviewed academic research. Once a paper is published in that, then it becomes part of the language, it becomes part of the accepted evidence base that can then be discussed. But until it's there, it's as if it doesn't exist. So all the fantastic work that we do as homeopaths that we've heard about already today is invisible to the outside world. Now, you may call me an optimist, but I believe that if we can start to get the evidence that we have from our practices, the right kind of evidence, out into the outside world, in using their language to a greater extent, or at least communicating why we can't use their language, then eventually it will overwhelm the lack of evidence, if you see what I mean. Because really homeopathy research is kind of in its infancy. So I've also selected those studies that have comparators, and that's because one of the arguments for homeopathy is often that, if there are any results, it's just regression to the mean. So you need to have a comparator to see that. Then I'm going to present a study that I've already completed, which was my first foray into research, just after I'd qualified as a homeopath. And I used to be a teacher in special needs. So I worked with children with behavioral problems, school refusers, and really didn't find I had very many tools apart from diagnosis and containment. I worked in a large pediatric hospital in London. We had a staff of 17 and we had 4 children. And yet, really, we were able to do very little. And then after I trained as a homeopath to treat my children first aid, of course I had some cases of behavioral conditions. And I was blown away by the effectiveness of single remedies. I remember the first child I ever saw. In fact, I didn't treat him. They brought him to me because they had such amazing effects with first aid. He had his hands covered in warts, and he had nocturnal enuresis. He couldn't read or write. He was 9. The house had been dug up. The switches had been taken out of the light switches had been unscrewed. And this child had tried to commit suicide. He was only 9. And my friend who referred him to me, who is a good first aid homeopath, she's not a homeopath, she just has a little book. And on the indication of the warts, she gave him causticum. And he learned to read within 2 weeks of this remedy. And if you look in the repertory, there's a very small rubric, inability to read in children. And causticum is one of the only remedies there. So they then brought him to me to see, as one of my trainee cases, to see how much more we could achieve. And I'm happy to say that every single one of the symptoms that I described just went. So I thought, we have to get this out there. You know, I wanted to take it back to the schools that I used to work in. And of course, then I was met with the evidence barrier. You know, there is no evidence. It doesn't work. So I thought, okay, I need to start to, what is this evidence thing? What's going on here? Is there no evidence? And first of all, I went to have a look to see what evidence there was. And then I was lucky enough to get a research grant, a small one, to treat 20 children homeopathically and start developing the evidence. And that's kind of really the journey that I've been on ever since. And then from that has evolved a clinical trial, which has just started recruiting now, thanks to a very generous funding from the HRI that Alex was describing. And finally, if I have time, I'm just going to add in a very small little project, not research, more like audit, which I've just started up for autism, with the idea, I'm going to introduce it to you very briefly, with the idea that you can get involved. So look out for the little signs, and if you get a bit confused about which thing I'm talking about, there should be a sign for each subject. Oh, am I not close enough? Sorry. The computers. There we go. So, ADHD and ASD. ADHD is problems with inattention, overactivity and impulsiveness, significantly interfering with affected individuals' family, peer relationships, as well as their educational setting. That's the dry description. In reality, as Hilary was describing, it can destroy families. It is the highest predictor of prison attendance in young adults. 43% in a recent study of young offenders were found to have a diagnosis of ADHD. It is a huge problem in our society, and it's a huge unaddressed problem. So it's a good condition, in a way, for homeopaths to be addressing, because it's unsolved. We have Ritalin, and in some cases it subdues the symptoms, but actually there is no evidence for the long-term effectiveness of Ritalin. Even after about 2 years, there's no differences between the groups on the children who've been given Ritalin and the children who've not been given Ritalin. You can't see the differences. The same outcomes, negative outcomes of criminality, of school exclusion, all these outcomes, they equalize out. So whilst Ritalin is producing some short-term reduction in symptoms and allowing the children to be taught in schools, and in some cases making life bearable for the parents for the duration of the action, actually it's not improving the situation in the long term at all. I'm not going to talk about autism so much, except to say that it is very unusual to only have one of these diagnoses. You know, the conventional medical establishment has specialized in creating lots of different names for lots and lots of different conditions. ODD, ADD, ADHD, ASD, you know, PSO. You could just go on with these things. And they're all interrelated. It doesn't really matter which one we as homeopaths choose to focus on, except that in order for our evidence to become accepted by the mainstream establishment, and that is my ultimate goal, we need to start collecting more studies. So Alex was talking about replication. We need to have, one study is not enough. You know, I'm not quite sure what the number is that's enough, but you just need to keep constantly repeating, taking the same condition and doing more studies and more studies until eventually the evidence for overwhelms any evidence against. And I think I'm right in saying in homeopathy, diarrhea and otitis media are the two conditions, is that right? That are considered to have sufficient evidence now. And to both those studies, I think, were done by Jennifer Jacobs, who also did one of the ADHD studies. So she's kind of one of our research stars. So this is a brief run through, and I'll try and make it brief, of the studies that already exist for homeopathy and ADHD. And I hope it's not too boring. I was told research is very boring, so I'll try and make it exciting. But what I want to show you is that the studies to date do not represent homeopathy as practiced by homeopaths. And this has been the journey that I've been on in the last 3 years of my sort of research explorations. So here we have Lamont. He started the bull rolling in the USA a long time ago, and he took kids who were getting into a lot of trouble. They were in care, and he gave them remedies. He gave them an initial case taking, and then he had no further contact with them. And they were given their remedies, and then the carers were asked to assess the results. And this was a great study. The carers, you know, showed that they had seen a lot of changes. Problem was, how did he assess the changes? He just asked the parents on a score of 0 to 5. Now, you and I would say, well, that's fine. You know, if they said they were 5, which is as bad as it can get, and now they say they're 0, which is as good as it can get, okay. It's not okay for the medical establishment. That's not a validated outcome measure. And so in a systematic review of ADHD, this study is discounted. It may have had fantastic results, but because it wasn't using the tools, the language of the conventional medical paradigm, it was not able to be included. And this is what I mean about trying to understand the language of research, because we can play that game. I really believe we can. We just need to learn the language. Next study. All these studies, by the way, were taken from a systematic review. So this one was a study of a homeopathic compound, selenium homicord. I've never prescribed it. Anybody ever heard of it? No? And yet, this study is used to decide whether homeopathy works for ADHD in the one existing systematic review. So all the children were given it. Actually, both groups got better, probably from just the thought that they'd been given something. And it got published in South Africa. So it's there in the peer-reviewed journal, and it's being used for generally, does homeopathy work? Fry, 2005. Anybody come across the study? It's quite famous, quite seminal. Yeah, he bent over backwards to show that the action of homeopathic remedies, because this seemed for him to be the most difficult issue of demonstrating the effectiveness, the efficacy of homeopathy. So he started off, he took a cohort of children, and they treated them using individual remedies, LMs, over a course of 6 months. And after they'd achieved a 50% amelioration of the symptoms, they were entered in the trial. They were taken off their LMs. They waited 6 weeks because he'd previously found that after about 6 weeks, the effects of the remedy had more or less worn off. Then he started the trial, and half of them were given placebos and half of them were given remedies. They were identical placebos and remedies. And he managed to show that there was an effect of the remedies. But there's a small sentence in the paper that says, this study was at the limits of the tolerability for the families. Now, if you were had a family with a child with ADHD, and you'd found something that helped, and suddenly you're told to go off it for 6 weeks, and then you're told to go on it again, and then you're told to go off it again. You know, it seems to me almost at the limits of the ethical okayness. And I also think, as homeopaths, there's a slight problem with this study because, yes, some children, it may not have lasted the remedy effect for 6 weeks, but some of them it might have done. And this is only one remedy. I don't know about you, but I found myself more and more needing a variety of remedies at my fingertips. And remedy pictures change over time as the child improves. It's not common to just have one remedy that can stick throughout the entire treatment process. So you can't allow that. There's no consultation, there's no changing of remedies. However, nevertheless, it did show effects. Okay, Jacobs study. This Jennifer Jacobs that I was telling you about, our research hero. Again, there was a consultation, but there was a consultation in both groups. So both groups were seen by the homeopathic practitioners with all the intention, with all the understanding, and the practitioners didn't know which group were given remedies and which group were given placebos. And in this study, both groups got better. So to me, it's a bit of an illustration of, you know, the entanglement effect, of the difficulties of separating out, you know, different aspects of the homeopathic consultation and the remedy. And I also wonder, in this method, they gave single remedies in high potency and not repeated. And given the story with Fry, where he said after 6 weeks there's no effects of the remedy could be seen. And the same thing happened in the very first study I talked about, Lamont. He also said that in the majority of children, after 2 months, there were no effects of the remedy. I wonder whether also this had something to do with it, that in this condition in particular, I think that there needs to be repetition. And certainly within the field, we're tending to use far more LMs these days because it's needed. And finally, very recently, it's a lovely study from India, single blind. So this time, the physician knew that which group was getting the remedies and which group wasn't. So there wasn't the entanglement of the intention of the physician as to whether or not she was giving it. And this study has really good results, really, really strong effects. And I can't wait to meet this researcher. I've been to 2 conferences that they were meant to be at, and neither time did they appear. So I'm longing to see them. And also, this was done after the last systematic review. And systematic reviews are the tools used by clinical decision makers, stakeholders, to sort of amalgamate the evidence and to sort of assess the results. And, we need a new review which can include this study in it. In my opinion, we need a review with individualized homeopathy as well, so we can exclude some of these other. There are a few other weird studies of single remedies. Okay. This is the only study, to my knowledge, with a comparator in autism by Barvelia, and again, it's very recent. And it's a nicely designed study. He measured the outcomes of the children for 6 months. It's what's called a within subjects study. And then, so he measured any changes during the first 6 months, and then they were treated homeopathically. And then he was able to compare the difference between the first 6 months and the second 6 months. And again, great results. And interesting to me for ADHD, he measured ADHD in these children. And again, the improvement of ADHD in these children with autism was pretty good. So that's a very brief roundup of the recurrent research evidence in behavioral disorders. Any questions so far?
Yeah, well, I just have one comment. This, because we were the prescribers on that one study, right? That was for 3 months. And now when I look at that study, the India study that lasted 1 year, of course, that's just a much better model. But we weren't given any choice on the design. And I guess there's an affordability factor in the United States, too. In other words, I don't know what it would cost in the U.S. to fund a study that lasted for a year.
Yeah. I think Fry and some others found that it took an average of 4.5 months to find a correct remedy for ADHD. It's a behavioral disorder. When you have a nice sort of set of warts or a nice eczema, you've got something physical to base your prescription on. Prescribing for behavior is a much more nebulous concept. The child may not be behaving the same way in the consultation as they do at home. The parent is at their wit's end and might be describing something very different to you than is the entanglement between the child and the parent is also an issue. So for various reasons, I think I agree with you completely. You need to allow some time for the right remedy to unfold, for a little bit of trial and error. And also in these studies, they found it took an average of 2 or 3 tries before the right remedy was actually found. In some, they never found the right remedy. I'm talking now generally within all these studies. Yeah.
Right. I have a question about you say that is ADHD and different other diagnoses. They are very similar to each other. They run over each other. Is it difficult when you do a study, when you choose a subject like this, to get the certain diagnosis of ADHD?
Well, it very much depends on the design. Can I leave answering that until I describe number 3 in my list? Because this is all about how I got to designing the clinical trial, if you like. All of the roads are leading towards that. And that was a very pertinent part of that decision-making process.
So, very, very short question. The single-blind study, why did they choose to do a single-blind? Because that would be such an easy one to shoot down, right?
I don't know, and because she didn't turn up to your conference, I couldn't talk to them. It's poorly written up. There's a lot of information missing. And also the other issue for conducting a systematic review is that the global ADHD symptoms are not quoted either. She has the individual hyperactivity, inattention, but not the global one. She doesn't describe exactly how I'm saying she may be he, doesn't describe exactly how the outcomes were arrived at. So they were. I don't think it was Oberoi who was due to come to the HRI. It was somebody else from that team. But the ISCMA conference the previous year, they were meant to come and they also didn't come. So I have to go to India maybe and find them. Yeah. Okay. Any other questions? So we moved on to number 2, the little Weeble people. That was the symbol for my first case study, which I just qualified, and I didn't really feel up to practicing. So I thought, if I can get somebody else to fund me, then maybe I can play around a little bit, see what I think works, and see what emerges for me as the kind of methodologies that I want to use. And I was very lucky to be funded by an ex-Borstal, a charity that tries to prevent children ending up in prison. And then I was even luckier to have that matched by the HRI. So I started off just treating 20 children with normal homeopathy. I saw them, I treated them, I tried things, I tried other things, and I treated them for a year, and I measured their outcomes. And this was under the advice of somebody called Morag Heers, who actually conducted this systematic review that I keep referring to. So we used an ADHD scale, which is the Connors Parent Rating Scale revised. Now, this scale is it's accepted by pediatric establishment. They use it for diagnosis. They use it to monitor change. So this was an important part of this process, was finding a measure that people knew what we were talking about. So the other measure that I used was MyMop. Now, I was comfortable with MyMop. Are you all familiar with MyMop? Yeah? No, if you shake your head, I'll briefly describe it. It is, I think, very well suited to complementary therapy, to measuring improvements, because it's patient-centered. It allows the patient to say to you, what is the thing that bothers me most about my condition? So that's symptom 1, and you have to name the condition, name the thing that really bothers you, and then you rate it from 0 to 5. So you choose 2 symptoms, then you choose an activity which your condition stops you from being able to do, and then you rate your well-being. So as a clinician, I like using it because it causes me to focus on what's bothering the patient. And you then, you sum up all those scores, and then you divide them by the number of items, and you've got a global score. So I was very comfortable with this. And I was also very interested by the results of this, because in my study, 16 out of the 20 put some measure of anger as the symptom that was the most problematic. And that to me was telling. It was a qualitative piece of research, if you like, that came out of this quantitative measure. However, I also included this Connors because I was told I should. But to be perfectly frank, I wasn't sure it was going to be able to capture the effects of homeopathic treatment, because it's a non-specific treatment, what we do. We're never quite sure what is going to change. And, the child's eczema might have got much better, but you're not going to see that on here. Everything might have got better except the hyperactivity, but we're not going to see that on here. Anyway, I needn't have worried. These were the results. I forgot to say that having started treating the 20 children who were receiving homeopathic treatment and collecting their outcomes, I then found myself with a lot of data and no knowledge about how to analyze it. So I went off to do a research master's to understand it, and they said, but and this was going to be my dissertation for my master's, you have to have a comparator. So having tussled mentally with this concept that I had to have a comparator, I then recruited 10 children who, again, systematically. So I first recruited the 20, one after the other, and then when I finished recruiting those 20, I went on to 10 who didn't get homeopathy. I went and visited them, I had a nice chat and a cup of tea with the mum, but I didn't do a consultation, I didn't think remedies, I just, asked them to fill in a few forms. And this is the difference in the 2 groups after 4 months. So the blue line are the control group, the ones that didn't get homeopathy, and the red line are the ones who did get homeopathy. So as you can see, in both measures, both MyMop and Connors, we have a similar slope. A similar improvement was measured. And I was mightily relieved by that, because I was using a measure that was accepted by the establishment, and we seemed to be capturing the effectiveness of homeopathic treatment. So just to go a little bit more into this study, these individual lines here are the lines of the individual patients receiving homeopathy. So they all start off in a bit of a clump on the left-hand side, and they're all, way above. ADHD starts to kick in about, as you can see, 55, you start to worry. Over 65, you're into markedly atypical. So they were all in the markedly atypical. They all definitely had a diagnosis of ADHD. And they're all clumped up there. And the first measurement is at 4 months in the middle line there, and then the final measurement of 1 year. And this is just the Connors ADHD scores. So as you can see, there's a group at the top where things didn't really move very much, about 4 or 5. There's a group at the bottom who've moved from markedly atypical right into the normal range. And I just want to talk about those two groups a little bit, because this was part of my exploration. What was it about those groups? Can we come to any conclusions? And when I looked at them, those ones at the bottom that had just gone from the 90th percentile right down to the 50th percentile, one of the main common denominators was a methodology that I had come to try to solve some problems in cases. It's called CEASE, which Bert is going to talk much more about tomorrow. So I won't go too much into it, except to say that it's an isopathic methodology. And these were children where the well-indicated remedy just didn't seem to hold. It would sort of hold as long as you kept going, but you had to work really hard to get it going. So, in one case I was just doing descending potencies all the time. And in another case, LMs, but still, the child lost the remedy or the LM needed changing. The case would just slip back again, and it was getting harder and harder to get it to work. And I was telling the group last night how I ended up doing this CEASE methodology. It was the mum who said to me, and this little boy, the 16-year-old, was doing very well on Burita Carb, but it kept slipping. And it seemed well indicated, but it just wasn't holding. And the mum said to me, I know why my child has ADHD. He also had Asperger's syndrome. She said, it's because I smoked cannabis when I was pregnant. She said, I didn't realize I was pregnant. None of my other children, have any problems. But I think that's what this is. So about 6 months into this study, I thought, I only have 10 minutes left? Oh my goodness, you're not getting the rest of that story. Anyway, he did very well on CEASE. I beg your pardon, I thought we had until past. I do apologize. Research is not boring. I get very excited about research. Okay, anyway, the common denominator of the exceptional responders was this methodology, where the parent identified an environmental issue very specifically, and giving that issue in isopathic form made this big difference. And I can tell you they were weird. So one was cannabis. One was laundrette chemicals, dry cleaning chemicals. The mum had worked in a laundrette all her life. Antibiotics, antibiotic exposure in utero. And the final one was a mum who'd actually been sectioned throughout her pregnancy and was on antipsychotic drugs. And actually, I never found a constitutional remedy for this child. I just gave him the antipsychotic remedy in potency, and it sorted him out completely. So the non-responders. This was my assumption of why I struggled, the outcome measures struggled to change. Situations with really difficult, chaotic families, where the mother is extremely stressed and in some sense is invested in the ill health of her child. Two cases really, that one I felt improved, but it wasn't measured in the outcomes. One with severe dietary sensitivities that I clearly didn't give the right bowel nosode to. I did try bowel nosodes, but they didn't do what they needed to. And one where really she had a diagnosis of ADHD, but she was fine. There was no indicated the parents were managing it very well. It was in the family. Child was happy. There was not much to treat, really. So these, very briefly, were the remedies. And I'm going to send you the slides, so I won't pause for those. Okay, number 3. We're getting there. This is what I'm doing right now. So as a result of numbers 1 and 2, it was clear to me that if we want to show that our therapy is effective in practice, we need to use the evidence about therapy as it's practiced in practice. And we need to measure the outcomes of the things that are bothering society. So in ADHD, it's things like criminality. It's things like school refusal, behavior at home, well-being. There's been a recent study showing that kids with ADHD are pretty unhappy, and their families are more unhappy. Their families are more likely to be divorced, it has a lot of impact, and it has a lot of costly impact. So it spans all the stakeholders in our services. So it spans in the UK, we call it the National Health Service. It spans social work because the kids are more likely to end up in care. The families are going to be more likely to be divorced. It spans the criminal justice department. I spoke to a judge the other day who said it's unusual in his caseload of 8 children daily to not have at least 3 children with ADHD. So every day, in coming up before his court, he's seeing 3. So it's impacting on all these services. So we felt, designing this project, that we need to measure whether homeopathic treatment can actually improve these outcomes. We're far from measuring which bit of the homeopathic consultation it is that affects it. Do we really need to know that it's the remedy? Do we really need to know whether it's the consultation and what percentage it is between them? What we need to know is whether the whole intervention can improve outcomes, and then that will speak to the purses of the decision makers in medicine, hopefully. So off I went to the University of Sheffield, and wonderfully funded by the HRI, to do this study. So the first thing we did, was the way we've designed the study. We recruited a whole load of kids with ADHD. We just said, can you come? Can you fill in this questionnaire? And we started doing this in September. So I'm pleased to say we have 22 so far who've signed up. And our aim is to get about 150. We're anticipating it's going to be difficult. When I say we, I am anticipating it's going to be difficult. These are really chaotic families. They come and they go, they start and they stop. We have an online questionnaire, which I think is improving things. And so far, what we seem to have got are very concerned parents signing up, really active, concerned parents involved in ADHD support groups. I'm still trying to work out how to get the ne'er-do-wells, the ones from prison, because I want them in the study. But this is an ongoing issue. Then once we've recruited them to our cohort and we've measured the outcomes, and we're measuring ADHD symptoms, the CONUS that I described to you, we're asking the parents whether the kid has got into trouble. We're asking about their well-being. We've got a well-being measure. We're asking about the kind of costs that they use. And we're also asking a similar set of questions to the children's schools. And this is where the blinding comes in, because the children's schools don't know what intervention the children are getting. And this is a really important element to the study, because one of the big criticisms leveled at a lot of homeopathy studies is, how do we trust the outcome? It could be biased. We think, I as a homeopath, I'm very invested. The parent is invested. The only way we can really trust it is to have somebody who has no idea which group they're in. So this is an important element of the study. To go back to your question about the diagnosis of ADHD, this has been a big issue because there are clinicians who only consider it a valid study with independent assessment of ADHD part of the study. We couldn't afford it. So what we've had to do is go for retrospective validation. So we're saying, when was your diagnosis? Who diagnosed you and where? And then we're going to retrospectively go back and cross-check a sample of them to make sure they actually have these diagnoses. And we're randomizing them to 3 different groups. So the ones with no offer, usual care, they don't know that they haven't got an offer. They just kind of tootle along as before. And then in 6 months' time, we'll send them the questionnaire again, say, thank you very much for filling in that questionnaire. Would you mind doing it again? And then there are 2 other groups. And the reason, so this is really 2 trials. The reason there's another group is because there's a thing called the Hawthorne effect, which is a bias. And just by doing something, just by having an intervention, it's considered to affect the outcome. So the idea of this trial design is that you have, several interventions, and then these particular biases are equally distributed between the groups. And as I said, the point of this trial is that it's pragmatic, it's real life. It's dealing with any school age, any additional diagnosis, so they have, up to now, every child has ADHD plus something else. Of the 22 we've recruited so far, half of them have autism, which is interesting. They're getting real-life treatment. They're getting the consultation. There are 5 different clinicians in the trial, prescribing according to their prescribing methodologies. They can change the remedies. There are no restrictions at all on the way they practice, except that I sent them all off for cease training before they started the trial, because I'd been so amazed by the effectiveness in particular cases. We are measuring, as I said, real-life outcomes. We're counting costs, and we're comparing with real-life treatment. So there's no placebos. And I really think this placebo issue has mucked up homeopathy research for long enough. We need to be telling people what goes on in practice and appealing to what they need to know. They need to know whether it can improve life. Need to know whether it can improve things. Okay, I'm doing all right. Very briefly, this is a project that I've just started up that Natasha Campbell-McBride, who Hilary mentioned, of the GAPS protocol, asked me if I would set up a study to measure the effectiveness of GAPS. GAPS is a nutritional intervention. So I thought, well, if I'm doing GAPS, I should do homeopathy as well, because, that's where my heart is. So together with Claire Elton, who's supervising me, we've added a little bit to an initiative that she started called Making Cases Count. And I want you all to pay attention now, because I want you all to get involved if you see autistic children. You just go to the Making Cases Count website. It's just makingcasescount.org. And then you see there, it says MACC, Making Autism Cases Count. What we want to do, and this is not research, this is audit, because as you are probably aware, autism is a huge unmet need, and unlike ADHD, where actually there is an argument that we've got a perfectly good intervention and the market is being cornered by the pharmaceuticals, there is really very, very little out there in conventional medical practice for children with autism. And it's desperately needed. There was a study that Karen was telling me about just yesterday where, the amount of cost to society of autism is huge, and it's not at all matched by the amount of funding being provided. So let's hope that will actually start to release a bit more funding for autism research. And I want to be in a position that we can take a project forward and say, let's do a similar project to the ADHD project in autism. But at the moment, apart from Bavaria, we really have no published information about what's going on in practice, who's treating these autistic kids, and what effects they're seeing. So this is what I want to start, to just collect some information. And this is where I need your help. So you go to Making Autism Cases Count, you go to MAC, and when you have a new patient with ASD, you ask them to complete the ATEC. Now, the ATEC is an autism questionnaire, an autism symptom questionnaire. It's not perfect, but it's free, and it's available online from the Autism Research Institute in the United States. So they can just go there, and they can just click on it, and they can fill it in, and then you ask them to give you their results. And then you fill in the form that I have put on the Making Cases Count page. No, that's the ATEC for you. That's the form that I've asked for. So you tell me who you are, you tell me what their ATEC score was, you tell me roughly what you did. And I'm collecting this data for this nutritional course, GAPS. I'm also doing it for the CEASE practitioners, so CEASE, and for homeopaths. So I need to know which group you fall into. It's fine if you fall into both or a mixture, but I just need to know. So you fill that in, and then you send it off to me. And hopefully, over time, we'll start to get a snapshot of some of the amazing results that we're getting from autism with treatment with homeopathy. Okay, that's me done. Thank you. Now get involved.
Fantastic, Philippa. We have we're 4.5 minutes over time. That's not bad. We've been doing good today, I think. Any questions for Philippa?
Yeah, that was very good, Philippa. I just have one question, because it's about validated outcome measures, and I think ATEC is not available in Scandinavian languages. It's available in Spanish, French, Italian, and some other languages, but I can't see on the list from Autism Research Institute that it's available in Scandinavian language, and that may be a problem if you ask someone to fill it in as part of a research project in a language that is not their mother tongue.
Very good point. I looked yesterday and I couldn't find a Swedish one. It's a project for somebody.
Yeah, but I was going to say, well, that's not impossible.
The Autism Research Institute are very open to any support. I mean, as you can see, there's many languages that you can already fill it in. So I would be really grateful if anybody did want to translate it. And all you have to do is to contact Bernard Rijmland at the Autism Research Institute. Karen, you don't have enough to do?
Another question? Any other questions?
You know, Bernie Rimland isn't alive anymore, you know that, but his...
Sorry, wrong one, the other one. What's the name of the other chap? There's two of them.
I don't know who you mean.
There were two who started up the Autism Research Institute, and
I don't know.
his friend, anyway, his friend
Anyway, I just
is very, sorry.
I just had a diagnosis question. So you said that there's a lot of crossover with diagnosis of autism and ADHD. I mean, that's not really our experience. In other words, we see kids with ADHD more and more who have multiple diagnoses, that now that they developed, invented, whatever you call it, bipolar disorder, that diagnosis bipolar disorder, it's rare, I think, that kids with ADHD have that single diagnosis. They have multiple diagnoses. They're on a number of medications. But, I don't know, you can answer this too. What do you think?
Well, I mean,
crossover between autism and ADHD.
I think it started in the UK, and I don't know if this goes internationally, because, no, it must do, because it's only recently been allowed as in the DSM-5 criteria. So while autism was the criteria in the DSM-4 didn't actually allow a diagnosis of ADHD as part of an autistic diagnosis. But in DSM-5, which is the current one, they do. So we're seeing a kind of ricochet of diagnoses of ADHD in autism in the UK as a result of the change in the diagnostic criteria. Same in Sweden? Yeah.
More questions? Oh,
You got
I feel
that.
like putting out a chair and sitting down and putting my feet up.
We go and have a sauna.
Thank you, Philippa. Great presentation.